welcome to the March edition of The Pulse. Gary Paxson with you here today, and with me is Lisa Lambert. Lisa Lambert has just been promoted to the Executive Director of Revenue Cycle. And Lisa, it's an honor to have you here with us this month.
Thank you. Good to be here.
Yeah. So Lisa, you've been with us for 32 years.
Yes.
And the majority of that you've been in the Director of Medical Records role, correct?
Correct. Mm-hmm.
So
about 32 years in the HIM role.
Great. So you were, at one point, you were a privacy officer.
That's right.
And so you held a lot of important roles in keeping our records private, secure, sharing them when needed to outside counselors, etc. But we've transitioned the privacy role.
We have.
It's to Deidre Thompson, correct?
Thompson. Mm-hmm.
So that's great. So let's really talk about this new role. It's been a pleasure to be able to give this elevated role to you. You've been a proven leader for several years, which we really appreciate.
Well, I appreciate the opportunity.
Absolutely. Your dedication to the organization is fantastic. And so, gosh, as we think about revenue cycle, we've talked in forums, we've talked with everybody that, employee engagement's a big deal. And boy, this department's needed some engagement for a while. To get to that business fundamentals, we've got such an opportunity. Billing and collecting are such a big part of what we do. First 3-4 months, really good results. Proud of your team.
We have had some good results. I'm interested in the hospital. I want the hospital to do well. This is my hospital.
Mm-hmm.
And so we have put really several processes in place to standardize processes throughout the revenue cycle to help for continuity. The revenue cycle really begins when the patient's registered and doesn't end until we receive final payment. And so there's a lot of moving pieces through that period of time. And so one of the things we're really focusing on right now is to making sure that we get the bill out the door clean. That's very important to us, and it's also very important to our patients. That we get the bill to the payer to where it's ready for them to process and for us to be paid, which in turn speeds up the process for the patient for their to get their statement.
Sure.
And what else might be owed.
Mm-hmm. Yeah, and that's an area we've embarrassingly struggled over the last couple of years, right? As we've had a lot of complaints from our consumers, which definitely not where we want to be. Working a lot to get that fixed,
right.
And so.
Yes, we're evaluating some of our vendors right now.
Great.
I know we've had some complaints from our statement vendor, our vendor that sends out our statement, that when folks call back that number for questions, that they're often not answered or they're put on hold for a long period of time. So actually that vendor is here on site on Wednesday of this week. So we're bringing them to the table to talk to them about that process. Definitely has to improve very quickly.
Absolutely. They're by extension a reflection of our family values,
right.
And
exactly.
those we got to hold them accountable. So
exactly.
So that's awesome. So love what we're seeing come out. We've exceeded some goals in cash collection and revenue for the last several months. So. Off to a fantastic start. Really proud of the team and everything. So, real quick, let's talk about family. You've been here for 32 years. You've got. Tell us about your kids.
I have 2 daughters. Sydney, my oldest, works at the breast center at UAMS.
Yeah.
She worked here at White River for a period of time in the radiology department. Love that.
Yeah.
And my youngest daughter, Allie, is in RN school at A-State.
Wonderful.
So in her first year with that.
Wonderful.
So,
wonderful.
Both in the healthcare field.
Yeah, that's great. That's a good thing. Well, it's such a. You've served our organization well. Thank you so much for all that, the years of dedication. Congratulations on the promotion. It's well deserved. I'm very excited to see the continued sustainability and improvement of the fundamentals out of that area and the improvement of employee engagement. So,
right. Well, I'd like to recognize Tina Simpson and Tara Grady have really been instrumental in the improvements we've made so far.
Yeah.
And so I'm really proud of the whole team. The whole revenue cycle, because they have stepped up.
Absolutely,
they have really stepped up.
Wonderful, wonderful. Lisa, thanks so much for being with us. We appreciate it.
Appreciate it. Thank you.
You bet. For the month of March, we have some great employees of the month to celebrate with you. From Stone County, Robert Lucy from the Respiratory Department has been with us for 19 years, and he's been recognized as just being a great provider of care for patients and helping other staff. Robert, thank you first of all for your dedication working with us for 19 years. That's a great commitment that we appreciate, and congratulations on being nominated and your great spirit of service. We appreciate that. At White River, Karen Taylor, a dietary aide who's only been with us for 9 months. So Karen, A, welcome, and B, congratulations on being recognized with such a short tenure. That's a great way to make an impression. We appreciate that. She's been nominated for the standard of respect, and we really appreciate that, Karen, and congratulations to you. In the area of news, the flu season has hit us really hard. There's a lot of flu in our community. Want to remind you that in Batesville, the White River Family Practice Clinic attached to Bryant's Pharmacy is kind of designated as a flu clinic, a walk-in clinic. If you have any symptoms and need to be seen, that clinic is open to you. And then on the weekends, we have the medical complex in Newport and in Southside have hours on Saturday and on Sunday. Great place to get in and out, be seen, get treated, and get home and feel better. And so wanted to help you be aware of that. A couple of great recognition events that have happened recently. Once again, for the third year in a row, White River Medical Center was nominated as one of the top 100 rural and community hospitals in the country. We're really proud of that. We're only one in the state of Arkansas this year that was recognized for that. So thank you for all your efforts at making our organization a great place to work and a great place to serve our patients. From a national perspective, both White River and Stone County have been named 4-star hospitals by the CMS on the publicly reported website for the hospital ratings. Congratulations to everyone, and again, I just want to thank you all for the great work. This is a team effort. Many hands were involved in reaching this achievement. Proud of that, want to keep that rating and even improve as we're able to, so congratulations. Have a couple promotions to talk to you about. Both Jennifer Sandage and Samantha Tate have been promoted to Assistant Chief Nursing Officers. Jennifer Sandage is working in more of the outpatient arena, and then Samantha Tate is working in the inpatient arena. Congratulations to you, ladies. We look forward to your helping us continue to raise the bar in the service that we provide in our nursing services across the spectrum of the health system. Brandon Langle has been promoted to Executive Director of Support Services, so he continues to be Director over Environmental Services, Environments of Care, and now he's going to be helping in dietary. And we're excited about the leadership Brandon brings to the table and what he's going to bring, and we're excited about that. Congratulations to you, Brandon. We also want to introduce to you a new Chairman of the Board of Directors for White River Health Systems. Kevin Rose has taken that appointment, and he's serving a 5-year term as chairman of the board. And so if you see Kevin, if you know him, welcome him to the team. We're glad for the service he's provided and look forward to working with him in his leadership capacity for the next several years. As we mentioned in forums, we've got some new communication platforms that we're going to be rolling out soon for you to communicate more to you outside of this medium and other mediums. 1 will be an app, and 3 will be social media platforms where we can push messages out to you, celebrations that we can do together, information and things going on in the health system that you need to know. And just, we hope it's a great way to close the loop from feedback we've received for you on the need to communicate more. So look for those in the coming weeks as additional ways for us to serve you. Thanks for all you do, everybody. Appreciate it. I hope you have a great month, and we will talk to you in April.